Welcome to the Survivor Core, not Facebook Live, but watch party conversation about anxiety during the time of COVID. I personally, having been through COVID, could not think of a more relevant topic. Not only is it Mental Health Awareness Month, but right now it feels like every day should be Mental Health Awareness Day, as we are living through some of the most frightening times ever most of us will probably encounter in our lives collectively. And there's no one who we can get better guidance from than Dr. Julia Samton, who is not only a psychiatrist and neurologist and a brilliant person, but also one of my best friends in the world and one of the kindest, most insightful human beings I have ever had the pleasure of knowing. And so I'm so happy and so proud to be able to share her wisdom with all of you. And so thank you so much for sending in all of the questions that you all did, amazing questions, and so many that I could personally relate to as well. Before we start, I'm going to just give you a little bit of background on Julia and her extensive pedigree. After obtaining her medical degree at the Albert Einstein School of Medicine, Dr. Julia Samton completed a dual residency program in neurology and psychiatry at New York Presbyterian Weill Cornell Medical Center. She maintains board certification in both specialties and uses her unique expertise to diagnose and treat a diverse range of mood and neuropsychiatric disorders. In addition, Dr. Samton is a certified meditation instructor, something we were both just practicing during our earlier technical malfunctions. Using her eclectic background and expertise, Dr. Samton works collaboratively with her clients, helping them gain wisdom, flexibility, and ultimately lead more satisfying lives. And honestly, who isn't in search of that at any time, especially given now? In addition to her private practice, she co-founded the Midtown Practice, a group practice that provides customized treatment to individuals experiencing a diverse range of psychological issues. So I will tell you that when I think back to my own experience with COVID, and the first question that I'm asked by everybody is, what were your symptoms? And you know, I can talk about the fever and the respiratory infection and the insomnia and the horrible GI issues and various other things. But the part of it that I sometimes want to talk about most, because they were so relevant to the experience and something that I haven't quite shaken yet, is the anxiety that goes along with the entire experience. And I think that that is something that we can all relate to, whether you haven't had COVID and you're afraid of getting it, whether you're afraid for a member of your family who might be particularly vulnerable, although we now know that we are all vulnerable, whether you are experiencing seasonal allergies and you're wondering whether that, you know, sinus infection is just a sinus infection or is it the first sign of COVID, whether you're in the throes of it and you are sick and you're home and you feel very, very much alone right now. It is such a frightening time, down to being, you know, through with it. I'm on the other end and I still have anxiety about what will the long-term consequences be for my body, having been through this virus. How do I re-engage with the world in a responsible way? Every choice that we make these days is full of anxiety. There's so many fears involved, and there are such mental health issues that need to be addressed. And I can't think of a better person than Dr. Samton to help us through those. So I'm going to start with the first question, which I thought was a really good one, and one I don't really understand the answer to, but I'm so curious to hear the answer. The question is, where does anxiety come from? Is it physical? Is it psychological? Is it, you know, can you explain first, like, what is anxiety? I mean, I know what it feels like. I know what the manifestations feels like, but what is it?
Yeah, it's such a good question. But I just want to give a tremendous amount of gratitude for having me here and having the ability to reach out to people and speak to the survivor core. And also, I just like, my heart is full of admiration and like just affection for the fact that you've been able to gather people together to unite in our common humanity and learn from one another. I feel like it's what life is all about. We have to remember that. So thank you for doing that, and hopefully I can help. So yes, I hope so. So first of all, amazing question. What is anxiety? And I love the question because I want to underline the fact that anxiety is actually a normal human emotion. In our society, in Western society in particular, we are taught that things are supposed to go well in life, that we are at home when we're having the good emotions, the joy, the fulfillment, the feelings of ease, the, that laid back kind of relaxed feel, and that should be our home state. But actually, human beings are very emotional, and we are huge reservoirs of attention. And that, of emotion, rather. And those emotions include good and bad. And anxiety is a natural emotion to have, specifically during times of uncertainty. It's mediated by chemicals in our body that are activated when we are not sure what the future holds. And it's something that most of us are going to live with our entire lives, but it's something that we can learn to manage, and we don't have to suffer.
Wow, that's super interesting. Like, I guess that's the whole goal, like how to figure out how to get through it without the suffering. And added to that, it's funny, I got an email right before we started this from a friend who watched my post about sort of having not my version of a nervous breakdown on the floor of my closet in the middle of having COVID. And she wrote like, wow, I thought everything was so perfect for you, but I guess that's social media. And so it's also important to realize that what we're seeing online from other people are their highlight reels, and they are experiencing the same anxieties that we are. They just might not be showing.
Yeah, I'm sorry to interrupt you. I wanted to tell you it's such an incredibly important lesson. In fact, the greatest lesson that I feel that I've heard in my work is how much we minimize the struggles of others. Like, people come into my office, they think they're the only ones in the world who have had these feelings. And I can always reassure them that that's not the case. That we all suffer, we all suffer with fears, anxieties, etc. Again, Western culture in particular places a great emphasis on showing only our good side. But we, despite what Facebook, Instagram, etc. Like to purport, we all have a mix of emotions.
I'm going to go to the second question. And you're going to have to explain part of this to me because I don't know what one of these terms means.
Sure.
So the second question is, my anxiety has spiked my gastroparesis symptoms. That's the one I need explanation on.
Yeah.
With all this going on, what do you recommend? The only thing I can imagine has something to do with stomach, given the word gastro. And I will tell you that I had the worst gastro issues you can possibly imagine during COVID.
Yeah.
And that lingered for well after. But what is gastroparesis symptom? What does that mean?
So gastroparesis it's a generic term that means that your stomach has delayed emptying, so you have a sensation of fullness quite frequently. And I think this individual was saying, and I couldn't tell if maybe that symptom was related to COVID, or maybe she has a pre-existing medical syndrome. I'm not sure, but from what I took from that was that she's having anxiety, or he rather, sorry, is having an anxiety, and it is exacerbating a physical symptom. And this sort of harkens back to what you were saying earlier, which is that we are conditioned quite frequently to suppress our emotions, our negative emotions. it's like a really easy jump. When we're feeling anxious, we're thinking, I don't like feeling this way. I don't want to feel this way, to it's bad to feel this way. So we have shame over our own feelings and we try to push them down, and they can essentially almost get trapped in our body. It's like, it's something that we can really feel in our body. We can feel muscle tension, our stomachs can hurt, digestion can slow down, and certain physical syndromes can get worse. So what I understand from this question is maybe this individual is having more severe physical symptoms because of the anxiety, even if they were already there to begin with.
That's so interesting. I mean, one of the symptoms that I experienced, and probably one of the longest lingering symptoms, and I think a lot of people in the group would relate, it was horrible insomnia.
Yeah.
And, with the lack of sleep over the course of weeks, it sort of exacerbates not only every physical symptom, but I felt like I was emotionally on like a balance beam. Like it would only take a small breeze to blow me right off. That sort of lack of sleep. So I can, can you talk more about that, like physical, psychological connection?
Yeah, definitely. And I'm so sorry you had that. And that we're all going through this.
Literally the most empathetic person on the planet.
I really am. I know. I hate to hear that we're suffering in this way, but okay. So when we feel anxious, quite frankly, what we engage in, what I like to call the unholy trifecta, which is we fight ourselves, because we have that anxiety, that fear, that uncomfortable feeling, and we're thinking like, why do I have this? I don't want it. And then we often get sort of critical about having those feelings, as I discussed before. We tend to isolate, and again, this is related a little bit to, we think we're the only ones going through this. We tend to isolate when what we really need is to reach out and share with others our experience, so that we can recognize that we are all human and having the same feelings. And then we tend to ruminate. And the rumination is, I think, what you might have felt when you couldn't sleep.
It hits late at night. Those middle of the night hours those are the times when, you start spinning.
Exactly. And it's how, as humans, we make ourselves absolutely miserable, is that we don't know how to handle uncertainty. We prefer to feel certain. So we fill in all of those blanks with the worst case scenarios. And in some ways, it's a little bit of a rigged game. I like to say that we are descendants from warriors. If you can think about it, our ancestors were wandering the savannah and like doing their thing, and they were outnumbered by prey and predator that could smell better, could see better, could hear better, had sharper teeth, were faster. And so
it's a good thing that to have some degree of worry. It was a survival of the more worried meant that you were aware and that you were out there and
exactly
conscientious of the threats around you.
Exactly. So that's who we descended from, the people that were able to protect themselves from over worrying.
Interesting.
So it's a little bit like our nature, which is why we really need to be kind and patient with ourselves, which we'll talk a little bit more as well. And we have to realize that despite the fact that our minds frequently go to the worst case scenarios, the worst case scenarios are rarely true. They're possible, but it's unusual when they're true. And certainly in the middle of the night, when we are no one to reassure us and only are fighting ourselves, that is when we start to kind of like leave the plantation.
Right.
I really want to emphasize that during those moments, we need to learn to speak to ourselves as if we were like talking to a good friend. So using phrases with ourselves like, I'm so sorry that you're frightened now. I'm here to support you regardless of what you're going through. Saying that to yourself, it sounds a little hokey,
No, I think that that's actually really, I mean, I think that's brilliant because, I mean, keep in mind that for most people who are sick with COVID, they're in literal isolation.
Exactly. Exactly.
So like, forget about like, physical or social distancing. We're talking about, lots of people right now. I mean, I went through 18 days of not leaving the four
Yeah.
walls of my bedroom.
Yeah.
And so,
Yeah.
yeah, I mean, that's amazing.
Yeah. Using those kinds of phrases with ourselves instead of, why do I feel this way? I can't wait to get out of here. I don't like this feeling. I have to beat it. I don't like it. I'm hopeless. And, you can even hear like the tone of my voice change.
Yeah.
You want to sort of speak as if you were talking to a child or maybe a pet or someone in your life that you can love without ambivalence, and say, I know you're having a tough time, but you're doing the best you can. You are, I'm here to support you. And literally using those phrases.
Almost like a verbal love letter to yourself.
Exactly, exactly, exactly. And, I think sometimes when I tell people this, they start to think about those old Stuart Smalley skits where, I'm good
Yeah,
enough,
good
I'm good
enough.
enough.
Right,
Exactly,
exactly.
exactly.
We're dating ourselves, but yes.
Exactly. We're totally dating ourselves,
Yeah,
but like,
it's okay.
I'm good enough. I mean, you can, even if you don't know the skit, but it's not really like that. It's learning how to reassure yourself actually breeds resilience, internal resilience. It builds that inner musculature that allows us to face our difficulties instead of running from them. So, we're not sort of saying, oh, you're so great, you're so great. We're saying, hey, like, let's be patient with ourselves. Like, you're frightened. May you have a little bit of peace. May you have some ease. These kinds of phrases are what we need to say to ourselves. It's what we need to say to our friends, our loved ones, and other individuals who are struggling.
That's great. I love that. I wish I knew that a few weeks ago.
I should have told you.
You should have, but you did give me really good advice all the way through. I will tell you. Okay, so the next question is this another. I mean, look, I think I can relate to every single one of these. Um, I'll be okay for a few days, but then I'll feel sick and I'll cry and feel depressed all day. Is this normal? And one thing to just mention before, Julie, you start answering is that one of the most unusual pieces I found about having COVID, unlike anything else I had ever, experienced, it's not like the flu where you have, you feel really crappy for a few days and then you start to feel better and the next day you feel a bit better. But it felt very much like this one step forward, one step back. And I would sort of like announce in the morning, like, I'm having a great day. And by 4 o'clock, I was like, oh my God, I can't believe I ever said that out loud because I feel like I'm going to die. So, going back to this person's question and, going through that roller coaster of, feeling okay and then feeling sick again and then getting depressed and crying as a result. Like, what's your response to that?
Hey, Diana, isn't that just so true of life? Like, you kind of want it to go
Yeah.
like this, right? Better, 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 but it's never, it's sort of like this. But hopefully you're moving in that direction. So I want to say to this individual who's suffering that it is normal, that grief is a jagged process, just like physical healing. Oftentimes it's 3 steps forward, 2 steps backward, and to have faith that you're moving in the right direction. And ultimately, I guess also written in that question, and maybe I am interpreting it in a certain way, but in that question, like, is this normal? I'm frustrated with myself. I just want to feel better already.
Yeah.
And again, really remembering to have patience and to realize that it is very normal, that there's nothing wrong with you, that life, unfortunately, like, again, we are conditioned to think that things should always go well and we should always be okay.
Right.
But that ultimately that we do have very, very difficult times. And it's during those times that we need not only humanity towards ourselves, but to share our humanity with others, which I think, which is I'm so incredibly inspired by your work because I know you and this is you. You are yourself, and you are able to tell people that exactly how you're feeling. You're not trying to like paint a perfect picture, and you're also saying, but I'm getting better.
Yeah, we're trying. You're right. It's
Yeah.
all,
Yeah.
it is, this is actually not part of the question, but one of the things that's been popping up in the group a lot recently is people dealing with lingering symptoms past their sort of official recovery and dealing with that frustration. So I think that everything that you just talked about really applies to those people also who are like, wait a second, I'm done. I'm on the other side. Why am I still feeling this way? Like, but I'm still having these lingering symptoms, and it can make you feel like you're going crazy because like, when will this ever end? And when, you know what I mean? But having that perspective, that longer vision perspective, I think is super important.
Yes.
So the next question was, this is a good one. I seem to have a lot of anger towards people who still think this virus is not serious. How do you deal with the anger I have? I'm not an angry person. What techniques would you have for me and others?
Okay, I really like this question because it gives me the opportunity to explain a little bit about my theory of anger. So anger is actually, this is weird, but anger is actually sadness. So what happens that we are very protective of ourselves. And again, back to what we've been talking about, we don't necessarily like to share our vulnerability. So if we feel sad, speed of light, we might move to anger. So example, let's say we're driving, someone cuts us off, and you feel for 1 minute, you feel like, oh, I'm a second class citizen. This person thinks they're better than me. Those are sad feelings. But very quickly, you're giving him the finger or her the finger, right? Whoever's just cut you off. But
I've been there.
Exactly.
It doesn't take much for me. I've got like the trigger finger on that psychological move.
Right, speed of light though.
I got that one nailed.
Exactly. You don't even know it happened and you're angry. But when I'm angry, I like to take a look at it and really try to understand it. It helps me actually handle it because at least I can recognize what it is, which is there's a seed of sadness. So what you're feeling is real because it's sad that others have not taken your experience seriously, and obviously you've suffered, and that's a really crummy feeling. So sometimes being able to understand where the feeling is coming from and what it is does give us a little bit of reassurance. The other thing is, like, in terms of reacting, when we feel angry, which again is like a little bit, it's sadness, but let's refer to it as anger because it can feel differently. When we have that feeling, actually our body begins to tense up. Our muscles become tense. We almost are making ourselves smaller in a way, if you can think. So what we want to try to do is make some actual efforts to loosen up.
Right, you're thinking, now that you say that, like, I'm like trying, like feeling that feeling, and I'm like literally like clenching.
Exactly.
Like even just thinking about being angry.
Exactly. And it's like, it doesn't feel good. It feels so much better when we're looser, and we're able to kind of like handle things and feel more resilient and at ease. So we want to maybe consciously soften our muscles if possible. And then here's another technique, and I love this. So when we are feeling anxious or angry, our body secretes a whole bunch of hormones that make us even more anxious. And I won't go into the science of it unless anyone's interested, but
just a little science.
Okay. So as I was saying before, we descended from worried ancestors. And when we were worried that a lion, a tiger, or a bear was chasing us, we needed chemicals to prepare us to fight or to flee. So those chemicals work to make our heart race, to make our muscles tense up in our limbs so that we can run. And actually, interestingly, blood is redirected from the brain to our limbs and IQ goes down. Like we all get a little stupid when we're angry.
So that fight or flight that we hear about.
Exactly. It's that fight or flight. And despite the fact that we are incredibly advanced and sophisticated species, there are parts of our brain that we still share with very primitive mammals, we share with reptiles, and that part gets activated when we're anxious or angry. So in order to, and it's mediated by neurotransmitters and hormones, and in order to reverse those, there's a whole nother set of hormones that are released, and they're released naturally, but you can speed that process up with some breathing exercises. So basically, when you breathe in, that's called inhale, when you're inhaling. And when you breathe out, that's the exhale. So a typical breath has an inhale, a little tiny pause, and then an exhale. If you want to activate those chemicals that can help you feel more at ease and at peace, your exhale should be longer than your inhale. So what I tell my clients and what I do myself is that you can breathe in for 4 and you breathe out for 8. And you want to take a deeper breath. Like often we're breathing from our chest. So we do these shallow breaths.
Your diaphragm instead.
Exactly. And the way that you know that you're breathing from your diaphragm, because like most of us are like, what the heck is a diaphragm? Is that you can put your hand on your abdomen. And when you breathe in, if you can feel your tummy press your hand out, that means you're breathing from your diaphragm. And when you exhale, if it goes in towards your belly button, goes towards your spine, that's how we know that you're exhaling from your diaphragm. So you're breathing in and then you're breathing out. And just make sure that the out is longer than the in.
That's great. Let's do it a couple times together.
Yeah. Okay. Let's do that.
Let's just do 2 of them. Okay.
Okay. Breathing in. And then breathing out. Breathing in for 4. Breathing out for 8. It's really lovely, actually. And
really, you can truly feel your entire body sort of relax, like physically relax.
Yeah, it's really lovely. And like sometimes during the COVID, when I'm having a difficult day, doing my own share of catastrophizing, what have you, I go for a run or I'm for a walk and I'll breathe in for like 5 steps and then out for 10, or breathe in for 4. So you can do it while you're walking, if that's easier. Some of us feel more at ease when we're at physical activity.
Right. Wait, Julie, I hate to do this, but we're going to run out of time. So we have a bunch of more questions to get to. So I already have anxiety on a daily basis from PTSD. Having the virus has just amped it up and compounded it with so many of my PTSD symptoms. Lots of my usual coping skills are unavailable and I need some tips on how to cope.
Okay. All right. So very common for trauma to trigger previous traumas. In fact, I've had a bunch of clients who have come to me as new clients and talking to me about how they are having all kinds of flashbacks and memories from other difficult times in their life. And also loss begets loss. So if we have had many losses in our past, we tend to feel all of those losses at once when we have subsequent losses. So completely normal, if that's reassuring. And the coping techniques, again, I kind of want to point towards the breathing. I want to, again, emphasize the fact that it's like our society is very, very set on it's important to be kind to others, do unto others as you do unto yourself, etc. But actually, what we don't want to do is do unto others as we do unto ourselves, because we're usually really incredibly hard on ourselves. So what we want to do is, again, use those phrases like, may I have some peace, like, I'm sorry, I'm suffering. You're going to be okay. Using phrases like that to reassure yourself as much as possible, as if you would a good friend, as if you would a child, as if you would a dog, someone that you feel is very easy to love and give unconditional love for, because that's truly what we need. Moving away from isolation, which is what many individuals with PTSD do. They retreat into themselves. Terrible idea. Again, it's natural. I mean, it's
Right.
what we're trying to do.
Right.
But,
I mean, don't we all?
exactly. But reaching out to others, very, very important, because that's what we need, is to really understand that we are all part of a larger world, all have times of suffering, and need to connect in order to heal both in body and mind. Yeah.
So here's one. Oh God, this sounds like quite a situation. I first got sick on March 26th at 30 weeks pregnant, and it's been a long, terrible nightmare. Went into hospital on April 2nd with every symptom possible and was denied testing. I got worse after 2 weeks quarantine and went back into the hospital. I was admitted and had an emergency C-section on April 19th because of what COVID-19 was doing to my body. I've been mentally drained and depressed since my hospital stay, and I'm home now, and my baby is finally home, but I still feel lost and depressed. How can I shake this horrible feeling?
Yeah, I mean, first of all, I think we can all say, you know, particularly as mothers, that you have been through an incredible ordeal, and a very, very difficult time. And I am, you know, like, my heart reaches out to you, and I'm also, I should say, very pleased that you are, you know, just by virtue of the question, that you are looking for ways to cope, and you see that you have, you know, at some point, a bright future. And I understand the feeling that you don't want to have, like, the sadness that you're experiencing. You know, I'm putting myself in your shoes a bit, but I can only imagine, you know, we think about having a baby. This was nothing like you were imagining. I'm sure that you had in your mind a whole different scenario. And I guess that some of the thoughts that might be running through your mind, you know, again, I'm extrapolating, so forgive me. You know, I don't like what's happening. This is not what I thought, you know, etc. And I get that. And I will also say that a tremendous amount of pain in life, and this is something we all do, comes from, we thought something was going to be one way, and it turns out it's very, very different. And ultimately, we compare our experience to this ideal of how we thought it should be. So what I think we all need to do, you know, and this is all of us, and particularly in your case, I think it's extremely difficult. I mean, having a baby should be a blissful situation, and it's not fair and it's not right. And,
So it can be
you know,
stressful even in the, you know, in the best of circumstances.
yes,
Yeah.
exactly.
You know, which is also.
Yes, and that as well. That's very true too. Certainly with, like, all of the changes in hormones, and the breastfeeding and the new challenges ahead. But you know, I want you to, you know, again, kind of say to yourself these phrases, because it's worth reiterating. This is very difficult, but I'm doing the best I can to accept the fact that just because the situation is nothing that you would have ever wished for or planned, it does not mean that it is wrong or a harbinger of the worst. It means that you are going through a very difficult time, and you are growing as a woman, as a mother, and you are going to do the very best you can to protect your baby and yourself and your family, and wait for the storm to pass. And I will say this too. We can all be deluded during these times that this will never end, because we have not, you know, had the proper guidance necessarily, and, you know, the science is baffling, but I can assure you that it will end. It takes patience, and it takes a lot of acceptance on our behalf, but this will end, and we will once again have our lives. And it's important to remember that. It's very, very easy to assume that we're stuck in here forever, but we are not. We are an incredibly resilient species. And in some ways, we've been training for this our whole lives. We can handle this, we can do this, and we are going to get to the other side.
Wow, that's super powerful. How can we calm our children's fears about the virus, especially if they have the virus or have had it?
Yeah. It's tough with our kids. And I have to I think it's pretty incredible that if your kids can articulate the fact that they are anxious or fearful about the virus. I mean, that's huge. It shows actually a tremendous amount of mental awareness. Most kids, like even some in this house, are not able to necessarily say that, and are maybe acting out in other ways. But I think if your kids can actually articulate that, they are so ahead of the game. And you can say to them that this is an incredibly uncertain time, but we are going to do everything in our power to keep ourselves safe, that you are going to get better, that we're going to get you the care that you need if your children aren't feeling well. And as a family, we're going to get through this. The most important thing that you can communicate to children, and I should say, I don't work directly with children and adolescents, but I have kids. And so I'm offering my opinion on top of that. But the most important thing you can say to your children during difficult times is that you are not alone, that I am always at your side, and that you will always have all the love you need. And those are promises that you can make. And I suggest that we do our best to, even though it might be quite difficult, to say that, because that is really what kids need to feel sort of safe and taken care of.
That's great. I mean, my kids both had the virus. And although they had it so early on that in a way they didn't have time to get scared about it.
Yeah.
And the truth is they both had extremely, extremely mild versions.
Yeah.
And I know that there has been a lot of talk about this Kawasaki's and we now are realizing that kids are more vulnerable to COVID than we had initially imagined, but it is still, as tragic as it is when it happens, it is a rare occurrence on the larger scheme of things. And so for my own children's experiences, my daughter, my 13-year-old, had a literal 18-hour version of COVID from beginning to end, first symptom to last symptom, 18 hours, done. My 11-year-old son had what we thought was a sinus infection that he couldn't kick. And some fatigue. And then it was only later on that he mentioned, he's like, oh yeah, and by the way, during that whole time, I couldn't taste anything. Everything tasted like styrofoam. And I was like, oh, well, that would have been interesting to know at the time. And, sure enough, we got them both antibody tested last week and they were both positive. And now are, bragging to their friends that they have antibodies, whatever that means. But in terms of, which
Awesome.
means kind of nothing, but but I think that's, I think that it also compounds our own anxiety.
Exactly.
In considering their level of anxiety, when in a lot of the time, I mean, at least in my own experience, my kids are much more concerned about whether or not they're going to get to go to sleepaway camp.
Yes.
And when they're going to get to see their friends next and get back to some semblance of life and having missed their sports seasons and that kind of thing, rather than the, I'd like to think that they were, up at night thinking about the state of the world and epidemiology. But, I don't think that that's where, I think that I have more concern about their fears than sometimes they are having fears themselves.
I think that's an amazing point. It's so hard because our kids can sometimes feel like extensions of ourselves. Yeah. So it's like we over empathize in a way, but most of the time our kids feel okay if we feel okay and we're able to reassure them.
Yeah. So this is a question that I guess is directed at me, although maybe you have more of an answer on this than I do. In fact, my mother actually wanted me to ask this question of you directly the other day, so now I get to do it in a very public setting on somebody else's behalf. Slightly, when can you socialize with family again if you have a negative COVID-19 test and tested positive for the antibodies? I assume what they meant is that they had an original positive PCR diagnostic test for COVID with a follow-up negative test. And then tested positive for the antibodies. So, which is my situation exactly.
Yeah.
And so, you know, I haven't seen my mother in 9 weeks. And because it's nice weather, we made arrangements for her to come out. My husband's going to go pick her up tomorrow and bring her out for a few hours, and we'll sit on the deck at a physically distanced.
Yeah.
But we waited for a day where it would be nice weather. Yeah. And we'll have one bathroom cleaned out, and so that if she needs to go in and use the restroom, but minimizing her exposure within our house, because even though we all have antibodies and none of us are contagious from our bodies, I still fear that I could be tracking it in from the supermarket on my shoes, or there could be some other way of transmission that I would not want to live with the guilt of having passed that on.
Yeah.
You know, what would your guidance be? Or
I mean, similarly, I feel like the CDC recommendations that came out, you know, a few weeks ago were fairly, you know, fairly liberal. I can't recall exactly what they were, but sort of no fever for 72 hours, no symptoms for 5 days, etc. But
although we are seeing, by the way, that almost everybody who's showing up 14 days symptom free to donate plasma is still showing up positive for the virus.
And on the nasopharyngeal swab.
Whether or not that means that they're still contagious, they are being put back into quarantine. So the one thing that I would say, just from what, you know, obviously Julia's the doctor on this, but in terms of this is a particular situation where somebody tested positive for the virus and then tested negative for the virus, which is a very different situation, I want to point out, than somebody who just tested positive for antibodies. Because if you get a positive antibody test, you can still concurrently be contagious. Right. That doesn't mean that you are no longer contagious. So I just want to make that clarification so that the two scenarios are not confused, because they're very different.
Right. I mean, I think the bottom line is that we all have to take a pretty conservative approach, because we are still learning so much about this disease. I mean, it's a relatively new disease. We're learning new things all the time. So ultimately, if we want to exclude any possibility of transmission, we have to take a conservative approach and use social distance, particularly when we're amongst the elderly and, you know, everyone. And, you know, use the same precautions until we know more. And we will know more, but right now we don't.
Yeah, and that is that is such a frustrating piece of it, is to be in this sort of very liminal state. So the last question that I have here is, when will the body aches and headaches go away? Why does this happen? And why won't the doctor retest you? As far as the retesting, I think that from what I gather, the latest is that if you are 28 days symptom free, you can assume that the virus is no longer in your system. And so that follow-up test is not necessary if you are indeed a full 28 days symptom free. But in terms of the body aches and especially the headaches, you're the neurologist. I mean, I know that I called you at various points when I was in the midst of COVID, and I've never had a migraine in my life, and I had headaches that were just unrelenting, to the point where I think I called you at one point asking if I could possibly have like some undiagnosed case of encephalitis or something, that like there had to be something causing this tremendous these headaches. And they do seem to be one of the last symptoms to go away. And the body aches, I haven't experienced, but what I've seen a lot of our members report are body aches that are like inflammatory body aches, like old injuries, almost like people are experiencing arthritic kind of inflammatory joint pain in a lot of situations. Do you have some insight onto those symptoms and why they linger so long and when they might go away and all of that?
I mean, the conception right now, rightly or wrongly, and again, like as this continues to unfold, we'll learn more, is that there are two phases of the disease. There's the effect of the virus, and then as the immune system mounts a response and the virus begins to fade away, we still have the effect of a fulminant immune response, and that can...
Wait, say that again in English. A what response?
So a very strong immune response,
Okay.
Because most of us have never been exposed to anything like this before. So our immune response is like, I'm gonna beat this
knock this one out of the park.
Exactly, I'm gonna do this. So it's almost exaggerated. It kind of goes over the top in a way. So it takes care of the virus, but then we're left with some of the deleterious effects of all of these inflammatory chemicals in our body that were used to fight the virus. The virus is gone, but it takes some time for them to dissipate, like to sort of go away. So what you want to do is really, again, conservative treatment, really lots of rest, lots of fluids. The fevers and the sickness itself can be very, very dehydrating, which can exacerbate everything. Really lay low a whole lot longer than you think you have to.
Yeah.
Like go read those books, binge watch those shows. You don't have to do anything at all. Just stay right where you are and allow your body just the time and the patience to heal. So unfortunately not a lot of hard answers yet other than time, patience, and self-care.
Yeah, I mean, I think that when people ask me for advice about, when they've been recently diagnosed with COVID and, what's your best piece of advice? One, I repeat one of the things that you told me to do, which was to keep a journal from day one with my symptoms, which was invaluable looking back on it. That was an incredible piece of advice. The other thing that I tell people is don't just keep in mind that this is going to last longer than you think it will. Yeah. And so if you go into it thinking that it's going to be at least a solid month or so before you feel a semblance of being back to yourself. I mean, I've been fully recovered for 7 weeks, and I went for a 45-minute walk last week with my daughter and our dog, and I had to take a 2-hour nap afterwards. And, prior to COVID, I had been exercising 5 times a week. I was doing yoga. I was like super in shape, and a simple walk knocked me out. And so I think that having a realistic expectation of the timeline can help you from, running into those like intense frustrations with why am I not better yet? Why am I not better yet? Well, that gets us to the end of our questions. Julie, I cannot thank you enough for shedding your beautiful light, your radiance, your knowledge, your empathy with all of us. I don't know if you're frozen there or you can join. I think that you are again. But I just wanted to thank you for, sharing your brilliance, your light, your love, your empathy with all of us. And if you have any last words to leave us on.
Yeah, again, grief is not a straight line. We can expect a bunch of emotional ups and downs. Don't judge yourself for feeling anxious, scared, concerned, and then don't judge yourself if you do judge yourself. Again, learning to be patient, treating yourself like you would a good friend or someone or something that it's like easy to love, and recognizing that we are all in this together. Yeah. And when life feels too much to bear, what we need is warmth and unconditional acceptance. That is what we all need. So keep that in mind.
Yeah. And the last thing that I would say is keeping in mind that um, I don't like the term social distancing. I
Yeah,
prefer physical distancing
yeah,
because
yeah,
being social is who we are as human beings,
yeah,
and we can, I've used this time. I've caught up with friends from high school I'd been out of touch with for a million years,
yeah.
rekindled old friendships. It is an opportunity to reach out on the phone,
Yeah,
not text, and actually talk to somebody and have a good
yeah.
old fashioned phone conversation that lasts an hour and a half, because guess what? You have nowhere to be.
Nowhere to be, nothing to do.
Yeah.
Yeah,
And you know what? And the other thing that I would also leave with is if you really do feel like you need something, you need help, reach out to somebody, reach out to therapists. There are, you know, there are so many online resources. Online therapy is amazing. If and take advantage of the resources that are out there.
yeah,
They're extraordinary, and you could be having this conversation with Julia or another psychiatrist or a social worker or
yeah,
whoever it is who fits your needs. But don't be afraid, even if you've never done it before
yeah,
and you feel like now's the time, take advantage of it and do it. There's no stigma to it. There's no you are doing yourself and your family and everyone else around you a
yeah.
tremendous service. It's the kindest thing it's the kindest gift you can give yourself.
Truly. Yeah. No shame in asking for help.